It's interesting, the field of neurochemical imaging in pain is also largely in its infancy. There's very few studies that have used this type of method to get at neurotransmitter levels or molecular information in the brain. The way it's done is you basically use a MRI magnet, so you use a very powerful magnet, and that magnet can be used to detect changes in proton sort of magnetic properties, basically. And the way the protons behave in different molecules is different. So like the protons in the neurotransmitter glutamate behave differently from the protons that are in GABA, another neurotransmitter. And so what the MRI magnet is able to do is it's able to perturb the activity of those protons, the magnetic properties of those protons, and as they relax back to their normal state, they give a signature output, which looks like a spectra. It is a spectra. And this technique is called magnetic resonance spectroscopy. So I'm saying this because it's fairly much at its infancy in chronic pain. There's not very many studies that have used it in chronic pain. However, there's been a lot of studies in other disorders like cancer, for example. Like tumors have been studied for many, many, many years with this technique because you can access metabolite levels, in the tumors versus the gray matter or white matter that it's close to. So it's just now beginning to become accepted, or used, I guess I should say, in the chronic pain field. Yeah, it's really quite interesting. So we did a study about 8 years ago showing that fibromyalgia patients, which we believe have a predominantly central neurobiological pathology, we found that fibromyalgia patients had increases in glutamate, specifically within a brain area that's involved in pain processing. This was in the posterior insula. And what we found was that the patients had more of this glutamate in that area, and the patients that had more of that glutamate in that area had increased sensitivity to painful stimuli. We then used acupuncture actually and showed that when you treated the patients with acupuncture, the ones that had decreases in their glutamate had decreases in their clinical pain as well. So that gave us some exciting data to then ask, could this glutamate be maybe a marker for some chronic pain disorders? And can it be a marker for treatment efficacy or treatment usage, basically? So we decided to look at pregabalin, which is a compound that basic scientists have known for years to bind to the alpha-2 delta protein of calcium channels. It's a subunit of a calcium channel. And what it does is when pregabalin binds to that, it's thought to reduce glutamate release into the synaptic cleft. So pregabalin is also efficacious in fibromyalgia. We know that it inhibits clinical pain in fibromyalgia patients. So our study was basically to ask, if we give patients with fibromyalgia pregabalin, does it change their glutamate levels in the posterior insula? And we actually found that to be the case. We found that pregabalin actually reduced the concentration of glutamate in the posterior insula in fibromyalgia patients, more so than when they were taking a placebo pill. And also, the patients that had higher levels of the glutamate before treatment were more likely to respond to the drug, pregabalin, compared to placebo. And so that's led me and others to kind of think that we might be able to use this neuroimaging approach for one, to sort of identify which patients might be good candidates for a certain compound that has a mechanism which you can sort of look at with the imaging, so a glutamatergic kind of mechanism. And second, it might be a method of doing drug discovery. We might be able to identify new compounds which we think might be working in a certain way. So for example, if a person is developing a compound and they think it might be acting on the glutamatergic system of the brain, maybe it binds to glutamate channels or whatnot, maybe it inhibits glutamate synthesis or something, you could very easily run a few patients through an imaging study very quickly, and the signal is so strong that you should be able to tell really quickly if your compound might be active. And that would quickly weed away, give you a good tool to say, no, I don't think I should go down this path, or yes, maybe I should continue on pursuing this compound. So those are some of the things that I think are interesting about this neurochemical imaging technique. I hope that's the case. I do hope that the work stimulates growth in that area. I'd have to say one of the strengths is that it gets you a window into the body and the brain specifically that you just can't get with normal methods, more standard methods. You can't access that type of information non-invasively in humans. And so that's why I think there is a place for this, definitely for the mechanistic type studies and as well maybe for developing newer treatments.